name is Dr. Hansler, I'm a pharmacist. Nice to meet you.
My name is Leyna.
Yeah, great, nice to meet you. May I just verify, I have a prescription here, I just want to verify your date of birth just to make sure I have everything correct.
It's May 23rd, 93.
Okay, I am actually seeing this a new prescription. I was just wondering if it was okay if I counsel you on this right now, if you have any time.
Yeah, that's fine.
Okay, so did your doctor tell you what this medication was for, or what it might be used for, the name of it?
I know it's for my diabetes, but I don't really remember anything else.
Okay, so that's correct. The name of this medication is called Metformin. Another name for it is glucophage, and it's in a class of drugs called glyconides, which are used for type 2 diabetes. Basically, the way this medication works is that it inhibits the amount of sugar that's released from your liver, and also helps increase the amount of sugar that your intestines absorb, as well as other tissues in your body by increasing the sensitivity of insulin to the sugar.
Okay.
Probably one of the main reasons your doctor probably put you on this, by looking at your lab results, is that your A1C is kind of high, and that's just pretty much of a measure of glucose constantly throughout the day, no matter if you've eaten or if you're fasting.
Okay.
Right now, I see it's about 7.3, normal is probably about 5.7. Also, did your doctor tell you how to take this medication at all?
I think he said twice a day, but I don't remember anything else.
That's correct. You definitely want to take it twice a day by mouth,
Okay.
with food, close to every 12 hours as possible. I'd say preferably take it with breakfast and take it with dinner, or take it at supper, but just don't exceed 12-hour time period between the first and the next dose. Also, I take medications too, and I can tell you I'm definitely not perfect. I definitely miss dosages, and I'm sure if you've been on any medications in the past, you might have as well. If that is the case where you do miss a dose of metformin, let's say if it's like you normally take it at 9 in the morning and you notice around 12 in the afternoon, you can go ahead, take a dose then, and then continue your normal dosing schedule.
Okay.
So as long as it's within 6 hours of you noticing it from the normal time you take it that you didn't take it, you can go ahead and do it.
Okay.
However, if it's been past 6 hours, just go ahead and take your next dose. Just don't double up on the medication.
Take my next dose at that time, or take my next dose at the normal time?
Take your next dose at the normal time.
Okay.
Also, I just want to mention too, do you have any allergies to any medications, or do you have any OTC or other prescription medications you're currently on at this time?
I don't think I have any allergies. My doctor said that this should be fine for everything. I don't have any other medicines I'm taking at all, just this metformin.
Okay. Also, too, I just want to let you know on this prescription drug that we have in front of me, it's for a quantity of 60 tablets, and you have 3 refills on it, including the fill for today. So it seems like your doctor just wants you on this medication for about 4 months right now, until he deems maybe he might want to change the dose, or she might want to change the dose of the medication, or just medication itself, or maybe if your diabetes goes resolved, maybe they'll stop things in general. Another thing I was meaning to mention too, did your doctor tell you what to expect from this medication in terms of side effects at all?
I don't think so.
Okay. So some of the common side effects of this medication are mainly diarrhea, upset stomach, nausea. Usually those go away within time for many people.
Okay, good.
Sometimes with some people they don't. Everyone has a different constitution, but most of the times it goes away. Very common side effect you'll notice in general is in your stools you might notice part of the outer shell of the caplet. That's very common. The medicine is working. The caplet actually has little holes that the medication, the active drug, gets released from inside your body, and the caplet just gets expelled in your stool. A rare side effect, but it can be very life-threatening, but extremely rare, is lactic acidosis. Pretty much what that is when your muscles and your tissues throughout your body aren't getting enough oxygen. Biggest signals you might, or symptoms you might notice if you have lactic acidosis is, let's say you're sitting down, you're at rest, your muscles start to cramp, you have all of a sudden a hard time breathing on top of that, and your heart starts to palpitate, and your skin might turn bluish. If you notice any of those symptoms, which could be lactic acidosis or other disease mechanisms which mimic that, make sure to call your doctor right away and go to the hospital.
Okay.
Also, by any chance, do you drink alcohol at all, or?
I like my glass of wine.
Okay. With this drug, it's best to refrain from drinking any kind of alcohol. However, if you do deem it necessary, just make sure to keep a blood glucometer on you, because alcohol can cause a fluctuation in your blood glucose levels. Definitely have the Metformin on you as well, just in case, obviously, if your blood glucose is way too high, or if it's really low, have some glucose tablets on you or something. Also, I just wanted to, before I finish the session, just reiterate with you, if I just make sure I told you everything right. Would you mind telling me, if you were to talk to a spouse at all, how you tell them how you're taking this drug, what it's used for, and what you might expect from this in terms of side effects?
Yeah, so you told me it's Metformin for my diabetes. I'll take it twice a day with my breakfast and either dinner or a small meal.
Right.
You told me that I'll be on it for about 4 months. I could have nausea, vomiting, diarrhea, and possibly lactic acidosis, but you said don't worry about that because it's rare.
Correct.
You said that I need to monitor my glucose if I'm still going to continue to have alcohol. Is there a certain place I need to store it at all?
That's a very good question. Definitely make sure to store this medication someplace that is dry and free from moisture. Definitely high enough to keep away from any pets or small children that might accidentally ingest the medication.
Okay. So I can do that. I'm trying to think if I had anything else. I think that was everything.
Okay, good. So do you actually have any other questions at all you might be thinking of in your top of your mind, or?
Tell me how to take it, when to take it, why to take it. I think that's everything.
Okay. Well, just before I head out, I just wanted to give you my business card with my name, my phone number on it. If you have any questions at all or notice anything going on, feel free to contact me at any time, Leyna.
Okay.
Also, if you wouldn't mind, if I could just touch base with you during your next visit when you pick up your next refill, just to make sure how things are going. Is that okay with you?
Yeah, that'll be fine.
All right. Well, Leyna, it was a pleasure to meet you. You
Yes,
have a great
sir,
day.
you too. Thank you.